Thank you, Madam President. Madam President, it's hard to think of much good that's come out of the 3 months experience with COVID-19, but here's one thing. The number of patients who have seen their doctors remotely through the internet, Facebook, all of the other remote technologies we have, including the telephone, we call that telehealth. Our health committee this morning had a fascinating hearing on telehealth. There was a lot of bipartisan interest from the senators, Democratic and Republican senators. The senator from Minnesota was the ranking member of the committee today at the request of Senator Murray. And my sense at the end of the hearing was that there are a number of things that we agreed on. I ask consent that my opening statement at the hearing this morning be included in the record following my remarks.
Without objection.
My colleague, the senator from Tennessee, who is presiding today, and I both know Tim Adams, who is the CEO of the St. Thomas Hospital System in Middle Tennessee. He told me on the phone last week that St. Thomas employs about 800 physicians in its several hospitals. During the month of February, there were 60,000 visits between physicians and patients in the St. Thomas system. Only 50 of those 60,000 were by telehealth, were remote. But during the 2 months of March and April, Ascension St. Thomas conducted more than 30,000 telehealth visits. That's 50 to 30,000. More than 45% of all the visits between patients and doctors during that time. Tim Adams expects that to level off, but still probably there'll be 15 to 20% of all of St. Thomas' 60,000 visits a month by telehealth. I talked to the CEO of the largest hospital in San Francisco a few weeks ago, and he said that during February, about 5% of their visits between doctors and patients were telehealth. He said that was a very high percentage for a hospital. But in March, it was more than half, more than 50%. Now think about that just a moment. There are 884 million visits last year between doctors and patients, according to the Centers for Disease Control. If 15 to 20 to 25% of those were suddenly by telehealth instead of in-office visits, that would mean hundreds of millions of visits a year would be by telehealth. It's hard for me to imagine that there has been a bigger change in the delivery of healthcare services in recent history, or maybe our country's history, than the sudden shift to telehealth in visits between patients and doctors. Now, telehealth's been around for a long time. Our witnesses testified to that. We had some excellent witnesses. Dr. Ruban from the University of Virginia, Dr. Kavidar from Harvard, who is the new president of the American Telemedicine Association, Dr. Arroyo, who is the founder of Project ECHO, which is well known across the country, and Dr. Andrea Willis, who's the chief medical officer of Blue Cross Blue Shield of Tennessee, which apparently is the first major insurance company to say that it will insure telehealth visits in the same way it insures other visits. What I recommended following the hearing was that two of the policy changes, which I judge to be the two most important changes in policy that the federal government made, be made permanent. The first is that physicians can be reimbursed for a telehealth appointment wherever the patient is, including the patient's home. That would change the originating site rule, as it is called. And the second is that Medicare, during COVID-19, has begun to reimburse providers for nearly twice as many types of telehealth services. That rule, those changes, I believe, also should be made permanent. What has happened is that we've had an incredible pilot program on telehealth. We've crammed 10 years of experience into 3 months. And we have a rare opportunity to look at that 3 months of experience and make a decision about what works, what doesn't work, and write the rules of the road for the future. It's not just the federal government changing, I think, a total of 31 different policies, all of which we should examine. States made some changes too. And those changes involve allowing individuals to cross state lines more easily to get appointments with doctors with whom they need to talk. And then the private sector is beginning to change too. I don't know of other insurance companies that have done what Tennessee Blue Cross Blue Shield did, but I know there will be some who decide on their own to begin to move to cover those services. Senator Braun, Senator Cassidy on our committee brought up the point that we want to watch carefully to see that we're not just adding to the cost of health care by telehealth. In fact, we ought to have an opportunity to reduce it. Our goal is always, when delivering health care services, is to have as an objective a better outcome, a lower cost, and a better patient experience. But it may very well be possible that telehealth not only improves the patient experience, we've had very few complaints about the convenience of that, and improve the outcomes, but it may also lower costs, which is a major objective of our committee. Last week, 10 days ago, I issued a white paper about the changes that I thought we needed to make, Congress needs to make, so that we can be well prepared for the next pandemic after COVID-19, the one we know will surely come. We don't know when, we don't know what the name of the virus will be, but we know it will come. And we need to take a number of steps to be as well prepared for that virus as we can. Whether it's accelerating treatments and testing and finding a vaccine, or collecting data in a different way, or better coordination of federal officials, all of those things are part of what we need to examine. And we need to do that this year, because our attention spans are short in this country. We move on quickly to the next crisis. And while COVID-19 is fresh on our minds, we should do whatever we need to do to get ready for the next crisis. We should do those things this year. Among those things we need to do this year is to make permanent the changes in federal policy on telehealth that allow this explosion of doctor and patient meetings by remote visits. People have been trying to think of ways to do this for a long time. Unfortunately, it took a pandemic to cause it to happen. Now, while we can see the result, make sure we don't have unintended consequences that are unfortunate, while we're doing that, we need to make those changes. So I recommend to my colleagues the testimony from our excellent witnesses this morning. 884 million doctor-patient visits last year in the United States, very few of them by telehealth. In the future, the estimates are there could be as many as 20, 25, 30% of all of them, hundreds of millions of doctor-patient visits by telehealth. That most likely is the largest change in the delivery of medical services that our country has ever seen. I thank the President and I yield the floor. And of a quorum.